His Research Council is currently conducting a public perception survey on the impact of the coronavirus on South Africans. It's currently conducting the second part of the survey, following the first survey conducted between the 27th and the 31st of March. But to tell us more about the survey, I'm joined via Skype by Professor Priscilla Reddy from the Human Sciences Research Council. Professor Reddy, very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Good evening to you and good evening to the viewers as well. Thanks for inviting the Human Sciences Research Council.
Well, it's an absolute pleasure. I mean, what informed conducting this survey?
Many issues informed us conducting these surveys. As you yourself indicated, the first survey was a very successful wave. And in the first survey, what we did was we just collected general knowledge and attitudes and perceptions to the COVID virus. But this survey here is a more important one in that it's actually collecting data on what's happening in South Africa during the lockdown, right from their knowledge and understanding of the virus, but how people are reacting to the lockdown, their experiences, their emotions, and whether they're abiding by the rules of the lockdown and which rules they're not abiding by.
I mean, it's safe to say, go on.
This will feed into a national collective of data, which actually enables the government to make evidence-based decisions. You know, much is shown about experiences of individuals and small groups of people by the media, but this survey will give us a broader view by a large number of people in South Africa.
It's safe to say, Professor, that most people do know what coronavirus is by now, but from your preliminary findings of this survey, but do they know the seriousness of coronavirus? I mean, judging by the number of people violating lockdown regulations and the arrests emanating thereof.
Okay, that's a very important issue to confront. Yeah, from our early data, the knowledge of what COVID virus is, how it's transmitted, the incubation period, and even what preventive actions to take was very high in South Africa. But this is high all over the world. The lockdown is a different experience. It's a difficult behavior. It's a behavior we didn't plan for, even though we had emergency regulations being put into place. So like the rest of the world, South Africans are having difficulty, but some South Africans are having difficulty with obeying the rules of the lockdown. But let's see what our survey shows us and exactly what's going on.
So what's the long-term impact of this virus on the already fragile economy and on the country's social fabric?
Well, you know, I think our country actually responded quite quickly in implementing the lockdown and the pre-lockdown, and so there will be spread. And as you know, you've just reported about people complaining about the impact on their businesses, on their ability to earn money. I myself haven't looked at the long-term data, but I think the world is being affected by what's happening with COVID virus. So yes, we're going to have a hard time, but so is the whole world. And the way we live, the way we work, the way we play, the way we talk, the way we behave, the way we entertain ourselves or have ourselves entertained will all change in the long term. I don't think we'll go back to where we were for a long time, but hopefully at some point, there will be a vaccine and we'll be able to take this virus under our hand.
Now, for purposes of understanding how the reduction of infections could be achieved, I mean, the country must have the capability of mass virus testing in place and the efficient contact tracing before the end of this month. I mean, just looking at the daily infection rates, juxtapose that with the number of tests that have been done, and then compare those with the country's population. Do you think that we're on the right path?
I do. I think the very fact that we've decided to test and trace and treat is remarkable. If you look at what South Africa has done, not even the rich countries have managed to do it. I think we will learn as we move ahead, and resources are being put into the testing. How it will pan out for the whole country, who's to say? But I do think we're on the right path. I do think that technology is helping us identify clusters of infection, testing, and quarantining people. I do think that it's going to have a big impact on the healthcare system. But I do think a positive would be to further set up our infrastructure in our healthcare system and work quickly towards developing a national health service, because an outbreak like this requires a national health service. And this would probably help us develop that further, because at some point we have to have universal testing.
Yeah. I mean, surely this pandemic has already had a huge dent on the country's economy, both in the formal sector and in the informal sector. So do you think that economic activities should be allowed, but in a way that is controlled, in a way that seeks to contain the spread of the coronavirus? I mean, there's been calls from different sectors, particularly the non-essential sectors, that they should be allowed to operate, but within the confines of what the regulations of the lockdown stipulate.
I think if you look at how our government approached this from an evidence perspective, a scientific evidence perspective, both from the health sciences, from the mathematical sciences, and from the social sciences. And I think the president has taken very responsible decisions, together with the Minister of Health, advised by a whole lot of people, including the WHO. And I think these decisions will be taken as we move further into the lockdown. You remember the lockdown was extended. And I think there will be a slow and careful move into opening up the economy, and it would happen at different levels for different sectors over a period of time. I don't think there's one national response. The different provinces would peak both in their cases, in their number of infections, in their death rates at different times, and we'll have to carefully monitor that and collect data. So the mass testing will also provide us with more data to make those kind of decisions that in a way that the economy would be least hurt. It's a very difficult thing for the government, because what do they take, the public health decisions or the economic decisions for the economic wellness of the country, or the public health and the health wellness of the country? Those are not simple decisions, and I have no doubt that our leadership is considering those decisions very, very carefully, based on information. And part of our survey will provide additional information for them to look at how the country, how the nation is coping with the lockdown, and where we can ease things and where we can't ease things. In the second survey, we've instituted extra procedures to collect data from people living in the high density areas, so we can give more targeted, tailored information to the national collective, so that these decisions can be well informed. I think the important thing with government is they're not guessing. They're going slowly, carefully, cautiously, but astutely.
Yeah, you're making quite a valid point there, Professor. I mean, it's very important and prudent that the government should start looking at ways of, post-COVID-19, how the economy will fare, and the reinvigoration of, making the economy much more vibrant again. But then, do you not think if the government could reopen the so-called non-essential sectors to operate, do you not think it'll open a can of worms? Because, which sector to choose, which sector to decide or to categorize it as non-essential or essential? For instance, the alcohol trade sector will also want to be, will also want to continue operating. The manufacturing sector, which is very key in the economy, has been branded as non-essential.
Well, I'm sure that, there are teams of people working behind the scene together with representatives from various industries to look at what mechanisms have to be put into place to open these industries. Because if you look at the first case in Germany, that first case happened in the motor industry, and they very, very quickly tracked and traced the first 2 people that were infected, closed that sector down, monitored, and then slowly open that sector. I think we'll have to go through, we're learning. We've never had a COVID virus before, and the country is learning. The world is learning. And I think South Africa is at the forefront of that learning and looking at how to do this. I don't think there is a single answer. We will not be able to one day wake up the next morning and say it's over. because you don't want a new set of infections to come up as well. So one has to be really, really careful. You can have a great economy, but all the people are dead. What good is that?
Do you think the lockdown should be lifted, but with the appropriate health and economic measures being put in place?
And the president has asked for a 2-week extension. At the end of that extension, I'm sure he will make his decisions in an informed way. What one thinks now is not important is what happens and how the people deal with the lockdown. That's important. I think we need to continue with messages pointing out that the lockdown is not for the lockdown's sake. We're in a difficult economic situation anyway. The lockdown is there as a responsible public health initiative. It is there to protect and preserve life. And I'm sure that's how all the decisions at the higher level will be made.
Now, finally, Professor, how do we access the survey?
First of all, to say that the survey is data-free. That you go to the HSRC website and there is a very clear link there. You just click on that link and it'll take you through. I see the link is right on your screen here, and the link takes you straight through the survey. We're talking a lot about the lockdown survey, but what we've also done is we have another survey which has already gone online, and that's the HEROES survey. South Africa is looking at talking to healthcare workers about what they know, what they feel, their mental health issues, their PPE issues, and actually how they're preparing and planning to cope with an increased number of patients in the hospitals. And I know there's much talk about healthcare professionals, particularly today with the UK Prime Minister lauding his healthcare workers. But in South Africa, healthcare workers are from doctors, nurses, right down to the porters and the cleaners who, clean the seat of a COVID positive patient. So we're also collecting data on healthcare workers. And during the week, we will talk more about that survey with you through our communications people. But the survey has been opened, and we're inviting all healthcare workers to go on online and fill in that survey. So again, we will have real scientific evidence of what's going on with our healthcare workers.
Professor Reddy, we certainly are looking to get in touch with you again to share more details on the outcomes of this survey, as that data is very important for the government to chart a way forward. Thank you so much for chatting to us this evening. That was Professor Priscilla Reddy from the Human Sciences Research Council joining us via Skype.